Now we're going to talk about spinal nerves. Spinal nerves are like cranial nerves in that they control sensation and movement. But this time the spinal nerves are controlling the sensation and movement of the body by communicating information to and from the spinal cord. So you have a total of 31 pairs of spinal nerves, which we talked about, the cervical, thoracic, lumbar, and sacral nerves. And remember, the names of the nerves are according to the origin point on the spinal cord. For instance, C1 through C8 are the spinal nerves coming out of the cervical vertebrae. The spinal nerves themselves are organized into rami, plexi, and dermatome. So we'll discuss what each one of these are. Okay, so let's take a look at the spinal nerve. The spinal nerve, you'll notice, consists of both the dorsal root, which remember carries sensory information, and also the ventral root, which remember carries motor information. So the spinal nerve is a combination of both, so sensory and motor. So the spinal nerves are a fusion or a mixture of both dorsal and ventral roots, which means they're a mix of sensory and motor fibers. The rami are the lateral branches of the spinal nerve. So here you'll see that the spinal nerve is out here, and then right after the spinal nerve, you'll notice that it starts to branch out. So the branchings are the rami. Now there's 3 particular rami that we want to talk about. The rami themselves will carry sensory and motor information. The dorsal ramus actually heads toward the back, and so it carries information about the back of your body. The ventral ramus will come towards the side and front, so it carries information for the front, lateral, walled, and limbs of your body. And the rami communicates over here, they're going to communicate information with the thoracic and abdominal pelvic cavity, so all of those visceral organs. So for example, if you feel a touch on your back, it's the dorsal ramus that's going to communicate that information to the spinal cord. Or if you want to move your upper arm, it's going to be the ventral ramus that's going to help communicate that information to the muscles of your upper arm. And if you feel stomach pain from the inside, your abdominal pelvic cavity, it's the rami communicates that's going to help you send that information to the spinal cord. Other spinal nerves to note are the intercostal nerves. These are important because they help in breathing. They also innervate the abdomen. So the intercostal nerve you see here actually wraps around the entire lungs on the inside. So the intercostal nerves are nerves T2 through T12. Next, let's talk about an organization of spinal nerves called the plexus. The plexus is actually a bundle of spinal nerves that are grouped according to their function. So the 3 plexi that we're going to learn about, plexi is plural, plexus is singular, is the cervical plexus, which includes spinal nerves C1 through C5. In addition, you'll find the phrenic nerve in the cervical plexus. The brachial plexus, which includes spinal nerves C5 through T1. The lumbar plexus, which includes spinal nerves T12 through L4. And then finally, the sacral plexus, which includes spinal nerves L4 through S4. The sacral plexus also includes the sciatic nerve. So let's talk in a little more detail about each of these plexi. The cervical plexus is actually going to control the neck. So the plexi are grouped according to what they control. The cervical plexus includes the phrenic nerve. The phrenic nerve is important because it actually innervates the diaphragm, which is used for breathing. The brachial plexus controls the upper limb. The lumbosacral plexus is a combination of both the lumbar and the sacral plexus, so we just combine it together as lumbosacral, and it controls the lower limb. So the lumbar plexus includes the femoral nerve and obturator nerve, which are both pretty large nerves. And the sacral plexus includes the sciatic nerve. So the sciatic nerve is really important because you might have heard of someone having sciatic pain or sciatica. What that is basically when this nerve, the sciatic nerve, gets pinched. And usually it actually happens at the lower back. Notice the sciatic nerve actually starts from where the sacrum is. So if you actually have a lower back injury, you might be pinching the sciatic nerve up here at the lower back, and that's going to send the shooting pain down your leg. So oftentimes when they're assessing back injuries, what they'll do is they'll ask you if you also feel the shooting pain down your leg. And that signifies that the back injury is pretty bad because it's pinching down on the sciatic nerve, which is causing that pain in the leg. So again, if you have back pain, it's going to pinch on the sciatic nerve and cause lower leg pain. Also, it's going to cause difficulty in moving the lower leg. The last thing we want to talk about here is the concept of dermatome. Dermatome is an area of skin innervated by a single spinal nerve. So what that means is that if we look at this map, for instance, take a look here at the back of the head. You see C2. That means all of the sensation on the skin of the back of my head is controlled by spinal nerve C2. Let's take a look at the thumb here. The thumb, if you look at here, is in the same area as C6. So that comes down the upper arm down to the thumb. So what that means is that if I touch my thumb, that sensation of feeling my thumb is controlled by cervical spinal nerve number 6. Another example, let's look at the inner thigh right here, L1. So what that means is if I'm touched on my inner thigh on my skin, in order for me to feel that sensation, it's my lumbar 1 spinal nerve that controls that. So this actually becomes very important in the clinic because they can use this to test to see if your spinal nerves are working well, if they're damaged. So for example, if I have no sensation when I touch the back of my head, then that might clue in that C2 might be damaged. Or if someone's touching my thumb and I can't feel that, that might indicate that C6 is damaged, and so on. So notice this is a great way to test if your spinal nerves are functioning, and it's completely non-invasive. All you have to do is go and touch different parts of your skin. So just to summarize the spinal nerves communicate sensory and motor information between the body and the spinal cord. They are organized into rami and plexi, and they innervate dermatomes.